Hormonal imbalance is the leading cause of infertility in women world over. You find women talking about this. My gyno told him I have low hormones. My gyno told him I have hormonal imbalance. In this very particular video, which you should pay attention, we are going to talk about hormonal imbalance, what it means, how you can treat your hormones, and how you can know that you have hormonal imbalance so that you can be able to get pregnant and give birth.
Ask Dr. Othman on Sawa Wall.
Hello my lovely viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. And I told you, if you'd like to get in touch with me to have a private conversation, because most of you don't want to ask questions publicly and you don't want answers publicly. So if you'd like to get in touch with me, go to my website www.drothman.com and make an appointment. I'll be there to chat with you privately. Now today we are talking about this very animal called hormonal imbalance. We would like to know what hormonal imbalance is. First of all, what are hormones? Which hormones are imbalanced? And how does this hormonal imbalance lead to infertility? This is the topic of today. So if it's your very first time to watch this particular video or to watch this channel, please don't forget to subscribe and also press the notification bell so that you can always be notified when we upload a new educative video. Now, hormonal imbalance. Let's first understand what this word hormone means. A hormone is a substance that is secreted from the body to carry out particular functions. It stimulates body activities. Now, these hormones are many in the body. There are very many hormones, because I told you one time that if you look at the body, if you look at our body, it's like a vehicle. It's like a motor vehicle. It's like a motorcycle or anything of that sort, a vessel. And it cannot work because a motorcycle or a motor vehicle has very many parts. It's like our body. It has many parts, especially the reproductive part, because this is the area we are talking about. If you look at the reproductive system, if you look at this reproductive system of ours, we have this is the vulva, of course, this is the cervix, the uterus, the fallopian tubes, and the ovary. This is the female reproductive system. This is the system responsible for number one, fertilization, and number two, keeping this fetus, keeping the baby so that someone can give birth. It is this system that gives a reason for women to smile after giving birth. It's this system that gives the gift of the womb. Now, how will this system work? This system works in presence of hormones. It is the hormones, these substances I'm talking about, that coordinate different functions. It is the hormone that coordinates the uterus and the ovary. It is the hormone that coordinates ovaries and the sperm, and so on. So it is the hormones that are responsible for coordinating activities around the reproductive system. So in case these hormones are low or they are very high, it will be very hard for a woman to conceive. I have seen several women crying about infertility. I have spent 9 years, I have spent 10 years, I am not conceiving. But you'll find that the problem is hormonal imbalance. I am not saying that it is only hormonal imbalance that can cause infertility. There are several other causes of infertility. However, this is leading, especially if it also causes the polycystic ovarian syndrome, which we shall be talking about in one of our next videos. So now, if these hormones are low or if they are high, then the coordination of these body systems, of these body parts, the parts of the reproductive system will not take place, and therefore you will not be able to get pregnant and give birth to a live baby. Which hormones are we talking about? We are talking about hormones like follicle stimulating hormone. Follicle stimulating hormone is one of the major hormones of the reproductive system, and this one is responsible for maturation or development or growth of the follicles. What are follicles? Follicles are the eggs. So the follicle stimulating hormone, its main role, its major function is found here. What does it do? It's the one that pumps up the growth. It's the one that pumps up the growth We call it follicle stimulating hormone. Follicle stimulating hormone. This hormone is responsible for growth and maturation of the eggs. What do I mean? When a child is born, of course you're born with some cells there, what we call the eggs, but they have not grown very well. And it is the follicle stimulating hormone that is sent to grow, to mature these eggs, or what we call the follicles. Therefore, if you have low levels of follicle stimulating hormone, my friend, the eggs will be there but immature. They have not grown, they have not developed. Now, how can an immature egg develop into a fetus? How can an immature egg be fertilized? It will not be fertilized. Are you getting it, my friend? This immature egg will not be fertilized. Why? You have low follicle stimulating hormone. Everything may be okay. Now people will be thinking, maybe my YouTubes are blocked. Maybe I have this disease. No, you are okay. Everything is okay. But this hormone has an issue. It is low in circulation. And therefore, your eggs are not developing. And that's why they're not being fertilized. And that's why you're not getting pregnant. And that's why you're not giving birth. Follicle stimulating hormone. There is another hormone, very, very, very important. It's called the luteinizing hormone, LH, luteinizing hormone. This hormone is also a brother, a sister, follicle stimulating hormone. What does it do? Now, when the follicle stimulating hormone develops an egg, it is this hormone, luteinizing hormone, that stimulates its movement from the ovary into the fallopian tube, in the process called ovulation. So it is this LH, luteinizing hormone, that mans the process of ovulation. You find women telling you, doctor, I'm not ovulating. Why you're not ovulating is because your luteinizing hormone is low. It is the one that comes and it monitors the ovary, which egg is mature, which egg has grown. It's like, there are some boys in the villages there that move around looking for girls that have gotten some breasts. So it's this hormone, luteinizing hormone. So luteinizing hormone looks around which area is grown. Therefore, start moving, and this egg will move into the ampulla. And when the egg moves here and you happen to have unprotected sexual intercourse, of course, the sperms will fertilize and a fetus will be formed. That is the role of the luteinizing hormone. Now, just imagine that you don't have the luteinizing hormone, or the luteinizing hormone is low. What will happen? Eggs will be there. They are mature. It's like girls, when they grow up in the village, they are mature, the breasts are all out, everything is okay, but there are no boys looking for them. They are not getting married. Hey, the family members start getting worried. In Nigeria, the Igwe starts asking, what's happening to that family? So, because this fetus, this egg is not being taken. Who is supposed to take this hormone? Luteinizing hormone. Take it where? To the fertilizer, to the man. I hope you're getting it. So that is the luteinizing hormone. Now we have another hormone. We have another hormone called estrogen. Estrogen. Estrogen, in science mainly we call it estradiol, but it is commonly known as estrogen. What does estrogen do? Now, you see, all these hormones work hand in hand. Follicle stimulating hormone did development, or made the ovary, the eggs to grow. Luteinizing hormone brought the egg into the fallopian tube for fertilization to take place. Now, the role of estrogen mainly, there are some other roles, but the role of estrogen mainly here is to cause thickening of the endometrium of the uterus, so that the underlining of the uterus is thickened so that implantation can take place. What does it mean? Fertilization has taken place. Now, this egg has to be, this fetus, the baby, has to be moved into the uterus, and it has to implant itself. This is the baby. This baby has to attach itself onto the walls of the uterus. And who does that? It is the estrogen. Why? It makes the underlining, the endometrium, thickened, giving a conducive environment for this fetus to attach itself, and then the baby stays in the woman's womb. And it is done by a hormone called estrogen. My friend, there is another hormone called progesterone. This is the darling for the baby. Progesterone. This progesterone hormone is the babysitter for the fetus. Once the fetus is already implanted into the walls of the uterus, once the fetus is implanted into the walls of the uterus, it is now the progesterone to grow it, to maintain it. So we say progesterone is the hormone of pregnancy. It maintains the pregnancy. And therefore, this is how important this hormone is. If every hormone is okay, follicle stimulating hormone okay, luteinizing hormone okay, estrogen okay, you'll be conceiving. You'll be getting pregnant. But after getting pregnant, 1 month, 2 months, you're bleeding. The baby is out. A miscarriage. You'll find women telling you every time I get 2-month miscarriage, 3-month miscarriage. I don't know what's wrong with me, doctor. Preterm birth, what? All those ones are as a result of low levels of progesterone. Now, another hormone we can talk about is called prolactin. Prolactin. What is the responsibility of this hormone? It is mainly responsible for milk secretion. Because when you give birth to a baby, the baby has to feed. The baby has to feed from the breast milk. And therefore, it is the prolactin that is responsible for milk letdown. You remember when we were studying agriculture in our primary, we talked about milk letdown in cattle. And it is made possible by this hormone called prolactin. Now, how will you know that your hormones are low? I am talking about the fertility hormones. We are not looking at any other hormones. We are looking at the fertility hormones. How will you know that your hormones are low? Now, if you are a lady, you've spent 10 years, you've spent 4 years without conceiving, and yet you're not using any family planning means, you're not using any contraception, then you should go to the hospital and ask for a test called fertility hormonal assay. This is the test that is used to measure the levels of hormones in your body, the levels of fertility hormones, the hormones we've talked about. And you'll be able to know that my follicle stimulating hormone is low or my luteinizing hormone is low, and then I need to do this, as we are going to be talking about in the treatment part. Now, when you go to the hospital or the lab and they carry out those tests, they will produce a result sheet like this. This is how the result sheet will look like. Of course, here they will put the hormone. The hormone will be there. Here they will put your value or your result. That's how they put. And then here they will put the normal values, all the normal ranges. They will put a hormone here, your result, that is the test result, and then the normal ranges. Now here, we are going to concentrate on the normal ranges, and now you'll be reading your results against the normal ranges. If they are within the normal ranges, then it means you're okay. If they are outside the bracket, it means you're not okay, and you need an intervention. Now, let's start with a hormone called follicle stimulating hormone, FSH. Now, if you look at this particular hormone, we said this is the hormone that is responsible for maturation or growth of follicles. Generally, the levels should be between 5 to 20 milli-international units per liter. 5 to 20 milli-international units per liter. Now, the ranges I'm giving here are the general ranges. However, these results or the normal ranges will depend on the time you've gone for the test. What do I mean? Some people will go there during the ovulatory cycle or ovulatory time when they are ovulating. Other people will go there during the luteal phase, others the menstrual phase, and so on. These phases may confuse you a little bit, but the doctor should be able to explain to you that we are not going to use this, we are going to use the ovulatory part. But here what I'm giving is the general arrangement. I'm not looking at whether you've gone there during your ovulation, you've gone there during your luteal phase, or the follicular phase. I'm just looking at the general ranges. However, when you get your result, you tally it with that particular time of the day or that particular date you've gone for the test. Now, follicle stimulating hormone should be between 5 to 20 milli-international units. When it goes below 5, that means you have a problem with your follicle stimulating hormone. Therefore, the eggs will not be maturing. Another hormone is called the estrogen or the estradiol. Estradiol, we are saying it should be between 20 to 400 picograms per milliliter. 20 to 400 picograms per milliliter. 20 to 400 picograms per milliliter. In case estrogen is lower than this, but remember I told you it will also depend on the phase you've gone there. Is it during the luteal phase, follicular phase, or the ovulatory phase? But if it's below 20, it means you have a problem with your estrogen, and therefore you need to seek interventions. You know, in the coming part, we shall be looking at the treatment, how we can treat this. So then there is progesterone. You remember progesterone? I said progesterone is the hormone of pregnancy. It is the hormone that babysits the fetus when it is still in the womb. Please be there, don't get out, please be there. You know, this hormone should be at least 3 nanograms per milliliter. Should be at least 3 nanograms per milliliter. So if it's less than this, then we have a problem. Now we have another one which is called the luteinizing hormone. You remember this hormone very well. The luteinizing hormone. The luteinizing hormone should be also between 5 to 20 milli-international units per liter. That is the luteinizing hormone. Now we have another hormone which is the prolactin. So prolactin normally it should be between 2 to 29 nanograms per liter. 2 to 20 nanograms per liter. But if you are pregnant, it should be at least 209 nanograms per liter. So prolactin should be between 2 to 29 nanograms per liter. But we are saying if you are pregnant, it should be at least 209 nanograms per liter. Why is it getting high during pregnancy? It's because we are preparing for what? For delivery. We are preparing for delivery because after delivery, the baby will have to suck. The baby will have to get breast milk. And we said, this is the man, or this is the woman responsible for secretion of breast milk. Therefore, it should be high or it should hike during pregnancy. And now, the last hormone we are talking about. This, I didn't discuss it in the other area because this one, like, it encompasses all these hormones, and it is called the anti-Luteinizing hormone. Anti-Luteinizing hormone, or AMH. Now, this particular hormone is able to detect the ovarian reserve. How adequate are your eggs? How adequate are your eggs? Are they able to produce an egg that can be fertilized? How adequate are your ovaries to produce an egg that can be fertilized? This hormone now encompasses all these ones. If all these ones, especially the follicle stimulating hormone, are okay, luteinizing hormone, everything is okay, then the AMH may be okay. However, we've seen cases whereby you have normal follicle stimulating hormone, but you have high anti-Luteinizing hormone or high AMH, and someone is not able to conceive. And these are people with polycystic ovarian syndrome. I told you we shall discuss about the polycystic ovarian syndrome in one of my next videos, but let me just put a hint about it. So if the anti-Luteinizing hormone is also supposed to be tested, and it is supposed to be between 0.9 to 9.5 nanograms per liter. 0.9 to 9.5 nanograms per liter. That is how this hormone is supposed to be. So if the anti-Luteinizing hormone is low, or if it is very high, then we shall also be having a problem. This is what we call the fertility hormonal assay. These are the hormones that are tested. However, we can also go on and do a little bit of androgen hormones. What are the androgen hormones? Androgen hormones are the hormones that are found in males. Now, if a woman is not producing, we try to find out. Because if all these hormones are normal, then there may be something wrong. What is that is wrong? This woman may be having male hormones, and they are high in her blood, and therefore they are suppressing the functionality of these other hormones. Assume a woman is having high levels of testosterone, because we've seen some cases where you find a woman is having beards. We've seen some cases where a woman is having strong muscles. We've seen cases where a woman is having a bold voice, and those are characteristics of male hormones. Those are characteristics of androgens. And now, if we find that this woman is having high levels of androgen hormones, then this woman may not be able to conceive, because you are too mannish. You are too mannish. You have high levels of mannish activities in your body, and therefore, when you have high levels of mannish activities in your body, it means they are going to suppress the womanish activities. And therefore, this woman will have issues with conception. The treatment. If we find that your luteinizing hormone levels are low, what do we give you? We have plenty of medicines in circulation. We have a lot of medicines. Therefore, if you do a fertility hormonal assay and they tell you you have low luteinizing hormone, don't get scared. There are a lot of medicines. You've been seeing people saying, I am taking Clomid. I am taking clomiphene. What is that clomiphene? And this is where I find issues with people seeking for babies, people with infertility issues. Every time someone says, I am having infertility, I have failed to produce, I've spent 9 years without producing, people will rush into telling you, swallow clomiphene, get Clomid, do this. That is not how it should be. Clomiphene should be swallowed if we find that you have low levels of luteinizing hormone. That means you are not ovulating. If you have a problem with ovulation, that's when we swallow clomiphene. So, number one drug here is clomiphene. And now, if we are talking about clomiphene, that is where we also talk about tamoxifen. Tamoxifen. So, clomiphene, tamoxifen can all work. We have letrozole. All these drugs can help us to increase the levels of luteinizing hormone. We have other drugs, bromocriptine. This drug can also be able to rise the luteinizing hormone. We have cabergoline. We have anastrozole, a wonder drug. Anastrozole. And then lastly, we can also use metformin, especially in people who have DM and so on. But let's not so much discuss about this, but it is also one of the medicines that can be used. So, if we find that your luteinizing hormone is low levels of luteinizing hormone, we shall use clomiphene, tamoxifen, letrozole, bromocriptine, cabergoline, anastrozole, and metformin. Now, what about if we find that your follicle stimulating hormone levels are low? What are we going to use? We have a drug called Follistim. We have another drug called Fatinex and Bravel. All these are drugs that can be used to increase the levels of follicle stimulating hormone. Therefore, if you do a fertility hormonal assay, if your doctor tells you that your levels of follicle stimulating hormone are low, don't get scared. The drugs are there. Now, what about if your progesterone is low? What are we going to do? Progesterone also has a treatment, the progesterone injection. There are several brands of progesterone injections that can be used to increase the levels of progesterone in your body. There are some medicines. There are medicines like Dufastone. All those are medicines that contain progesterone, and they can increase the levels of progesterone, and then you'll have no problem with conception. You'll have no problem with recurrent miscarriages. Now, what if we find that prolactin is low? Prolactin. Because we said prolactin is the one that leads to secretion of milk. We use bromocriptine, we use cabergoline. All those hormones can be used. Now, lastly, if we have a problem with estrogen, what do? Problem with estrogen, use estrogen replacement therapy. The medicines are there to treat low levels of estrogen. Therefore, my friend, my dear friend there, if you spend years, if you fail to conceive, don't just rush into conclusions of saying, I have this problem. First, go to the hospital, do all those particular tests we've talked about, do a fertility hormonal assay, do the other tests we talked about in the previous episodes of infertility, find out what is causing your infertility, then you'll be able to get the right treatment. I told you if you'd like to get in touch with me, to have a private chat, a private conversation with me, because some of you are not able to put your questions here or to unleash your private issues in public, you can go to my website, www.druthman.com, make a private consultation. I'll chat with you online and we shall find a solution for whatever problem you have. Thank you very much. If it's your first time to watch this particular channel, please don't forget to subscribe to our YouTube channel. Press the notification button so that we can notify you of any video we upload. I sign out.
Ask Dr. Othman on Masawa